if you don't, they are two absolutely extraordinary people who have really steeped their careers in community academic partnership and worked both on both sides of the aisle, as they say. I've asked each of them to just quickly talk about their career path because I think it's very helpful in how they came to this. Nikki, do you want to start?
Sure. Thank you, Lucy, and thanks everyone for having us today. So Nicole Thomas, everyone here at Penn calls me Nikki. I came to Penn in 2004 by way of West Philadelphia. I am a lifelong resident of West and Southwest Philadelphia, who comes from a family of community activists. My grandmother had a nonprofit in West Philadelphia for several decades and really, um, I guess, planted the seed for within me, just really focusing on the importance of community academic partnerships as a way to address some of the issues we face in West and Southwest Philadelphia communities, as well as communities across the city of Philadelphia. So my background is actually in business. I am an entrepreneur at heart. I had a sock company, SOCK, with my brothers for about a decade, with 13 retail locations, 2 wholesale locations. We were in Five Below initially, but couldn't keep up with their growth before they even started. So the folks who are the founders are our friends, and we learned a lot from them. But I ended up coming to Penn after that business and worked with Dr. Jerry Johnson, Chief of Geriatrics at the time, doing this community engaged work, research, as well as just partnership service under he had a Center for Minority Health and Health Disparities at the time. So did a range of things, really learned about this environment. And I always say that when I first came to Penn, I had no health related background or research backgrounds. And I was really intrigued by all of the work being done here across the university and was able to collaborate with folks both at Penn and at CHOP. I see some of my colleagues from CHOP here. And just learned a lot. I approached my work as a classroom and ended up coming to a place where I was really interested in helping to build the capacity of community members to partner in research through the Penn Community Scholars Program, which you'll hear about, and then the REACH initiative. I'll stop there. There's a lot more, but it will take forever.
All right, I'll go. Hi, everyone. Good to see familiar faces. My name is Sarah Solomon, and I am the Deputy Director for the Penn Injury Science Center, and I co-direct Penn Community Scholars and REACH that we're talking about today. I have been, for my career, working with disadvantaged communities to try and figure out policies, practices, et cetera, on working towards prevention of a variety of health diseases towards a more just and equitable society. So I started out
Well,
after, studying
Sarah,
issues around,
Sarah, you're
yeah,
going in and out a little bit. I think you need to,
I'm going to move. Okay.
yeah.
Um, sure. Is this better, Lucy? Okay. So I will just move environments here. So I started out in academia. I was fortunate enough to move into city government. And I really came to Penn after working across different sectors. I've mentioned city government and academia, but also with community-based organizations, and finding that love of working across sectors, which has brought me to the work that I'm doing today with Nikki and Lucy and Andrew. So we started this work about over 10 years ago. I've been at Penn, And I consider myself a community engaged implementation scientist, as I'm now finishing out my studies and getting my doctorate in public health with a focus on implementation science. So I come to this work with my heart. I guess the simplest way is, always wanting to help those in need. And while it's not the best thing to say when you walk into a community these days, that's where I started. And I've learned a lot from community along the way to even say that better. So happy to be here and talk about some of our work.
Lucy, did you want me to start the screen share at this point?
Yes, please.
Okay, so we're going to talk a little bit about two programs, which we hope helps to build bridges between community and academics, REACH and the Community Scholars Program. I am also a candidate for a doctorate degree. I am in the program here at Penn for Higher Education Management. And so Sarah and I sort of converge our thinking and ideologies and beliefs around how important this work is to address some of the health disparities, as well as just advancing like community academic partnerships so that they're sustainable, they're more equitable, and attainable for folks. Andrew? This is our team. REACH stands for Research and Equity and Academic Community Partnerships for Health. It was started just last year, actually launched. And Andrew, I just want to mention, because he's not going to be speaking, is our Director of Communications and Data Analytics. So he really helps us think through all of our communications activities, coaches some of our clients with their dissemination needs, and he's really an awesome person to go to for data visualizations and these amazing slides. Andrew? So we'll talk a little bit about the need that we recognize to include community voice in research, the development and success of the Penn Community Scholars Program, and then how we form REACH and how we hope that REACH and community scholars will benefit Penn academics and communities. So this will be an interactive presentation. I'd like to ask you to join the presentation by either scanning the QR code. You can use the URL here, or you can use your phone to send a text message to 22333 saying join. So we'll give you a moment to engage, to get into the group. Okay. Looks like for the folks I can see, looks like folks are still working on it. Okay, so we're going to move forward and jump right into our first question, which is, how equipped are you to create effective community academic partnerships rooted in principles of equity? 1 would be not at all equipped, to 5 would be very well equipped. So if you can just enter your responses using a number. Okay. It looks like, yeah, it ranges. So folks are fairly well equipped, and it's across the board here, I'll say. But on average, folks are fairly well equipped with 36%. Um, four would be about somewhat equipped, so 33% now. And so we can see what we've learned is that over time, Andrew, you can move forward. Over time, we've learned that this is sort of aligned with what we've heard from other academics at Penn. Though Penn has long had a value in partnering with communities and really serving communities as part of its threefold mission of research, education, and service since its inception, which really made Penn stand apart from the beginning. And there's a desire for investigators, clinicians, practitioners, academicians to partner with communities and research and other initiatives. We found from early investigators and tenured faculty alike that they're not always sure of how to find and cultivate the relationships with community members to build those authentic partnerships that can be sustained across time. Also, Andrew, also, so I'm gonna ask the poll first, and then I'll go to my next point. So here's another poll. What is the biggest gap in community academic partnerships for junior faculty? And this is free form, so just type in whatever comes to mind. What is the biggest gap in community academic partnerships for junior faculty? Having time. Communication, time, lack of understanding on ways to build authentic partnerships, operational needs, time is coming up, consistent engagement. So time is a huge factor. Does anyone want to say a little bit more about time specifically, or any of the things that you listed here? Any comments?
I can just, this is Steve Laff. Hi, Nikki.
Hi, Steve.
I think I put time because I think that you really have to commit a lot of effort and time in order to do this work and to do it right. And I think especially for junior faculty, the amount of time that's given in order to do this and the other demands are great. And so I think I think that can become a real challenge.
Awesome. Thanks, Steve. Any other comments? All right. So now we're going to ask the same question for senior faculty. What is the biggest gap in community academic partnerships for senior faculty? Again, a free form response. Conflicting multiple priorities, again, time. No surprise there. Anyone else? Okay. So changing community landscape. Can someone say a little bit more about that, changing community landscape? Okay. All right. It's meant to be anonymous, so you don't have to. Okay, Andrew. So back to these original ideas that Penn is committed to doing the work. We have folks at Penn who are really invested in partnering with communities. Yet it's difficult for folks oftentimes to cultivate relationships and find the right partners. Andrew, so essentially what happens, as we know, is that underserved populations also have a difficult time accessing research infrastructure, the training needed to really engage as partners in research, and have been left out of the research process. We've seen an underrepresentation of minority groups as research subjects, partners, and lead investigators. And research that doesn't include people with lived experience is less impactful, less relevant, and less translatable. So this was really highlighted during the COVID-19 pandemic, which we saw the stark racial disparities and really led to a renewed attention to issues of racism, social inequality, and health equity. Today, funders are increasingly responding to the need and really requiring that there's community authentic community voice and partnership. Investigators, many of you have been doing this work for a long time, but many others are really paying attention to the importance of involving and engaging with communities to really strengthen the research and add value overall. So the Penn Community Scholars Program and the REACH Initiative, we hope, have helped to build pathways to bridge the academic community divide. Andrew? The Penn Community Scholars Program was founded in 2015. Just to give you a little bit of background, I co-led the community course along with Lucy and others for the Robert Wood Johnson Clinical Scholars Program for years. And once the program was no longer funded by the RWJ Foundation, we were allowed to apply for a $50,000 grant to continue some of the community engaged work that we were doing. So we had the idea of creating the Penn Community Scholars Program, which was founded in 2015. To date, it has graduated 88 individuals representing 77 organizations. And it's a cohort-based model which spans 2 semesters, 14 sessions, which is roughly about 2 sessions each month with the culminating pitch. The goal of the program is to build research capacity for community leaders and community-based organizations so that they are able to serve as partners to build more beneficial and equitable and transformative research studies. So we have the didactic lectures that happen through each session. There is actual skill building activities connected to each of the sessions as well. We bring in content matter experts to talk about the research process, different aspects of it, health equity, etc. We have peer-to-peer interaction, group facilitation, and we also have individual coaching, which we find is one key element that the participants really enjoy. So each of the scholars who participate in the program are required to have at least 3 one-to-one coaching sessions where they're really working on their ideas, starting with the problem statement, and then really thinking about their solution or the solution that their organization would like to propose to address that particular problem. So we use a problem, we anchor it starting with sort of like thinking about problems and walking them through the course to really learn about, to really dig into that problem and come up with a pitch at the end. So they deliver a 5-minute pitch to a panel of judges who are funders from foundations in the area, as well as 2 academics from the University of Pennsylvania. And so what we've learned from our evaluation is that the confidence to participate in research, knowledge and attitudes and beliefs around research has increased through participation in the Community Scholars Program. And that's just depicted pretty quickly here. I won't spend a lot of time talking about this, but we have a whole evaluation that we're happy to talk about later. Andrew? So we have a network of community scholars alumni who we engage with regularly, and they're really prepared to partner in research. Some of them have done amazing things, which you'll hear a little bit about from Sarah shortly. And they're positioned to really connect with Penn academics who have similar research interests. We also have academics at Penn who we hear from all the time who have been challenged in identifying, initiating, and sustaining relationships with community partners. So what we're aiming to do is to build the infrastructure here at the University of Penn to help make that collaboration, those connections easier and really support them once they have made the connections with the right community partners. So REACH basically serves as an accessible university-wide resource that helps to foster meaningful community academic connections. And Sarah will talk more about REACH.
Thanks, Nikki. And hi, everyone. Thanks for having us today. So as Nikki was saying, we have a robust community scholars program that we've been doing since 2015, about 10 years. And the gap that you saw in that picture on the screen was really there wasn't a equitable and efficient way to help these cadre of trained community scholars, as you saw, over 88 in the city alone, to find a partner in academia. And so that's where we co-developed REACH. We used a participatory approach. Next slide, Andrew. And we talked to input from 141 stakeholders, some of the people on the call, in interviews and focus groups. We had some surveys. We did some user testing with a website design that I'll talk about in a little. And we were trying to identify first some of these barriers and challenges, similar to the questions that we asked on the call today, and then to actively map these challenges to a set of implementation strategies that we heard would serve the greatest need from the people that we talked to. So their insights from, the 141 stakeholders, which again were similar to some of the things you brought up today, directly informed REACH's design. So next slide, please. And what it came out of was this blueprint for implementation, or a roadmap of programs and services that REACH offers. And I'm going to go through each of them, and then we're happy to expand on answer any questions. So the first one was to expand this thriving program and existing network of trained community scholars. And so we still are offering the Community Scholars Program. We have a cohort going on right now, and we try and get the word out to faculty and other partners such as yourselves, so that if you have a community partner that you've worked with in research or in practice that you think would benefit from the program, we love taking referrals. We are also expanding our programming to plan a partnered cohort program that promotes peer learning, so that community and academic partners can learn side by side from each other with expertise, experts and content expertise from both sides along the way. So that's something we are developing now, and you'll hear more about. Next slide, Andrew. Moving on, there are services we've already started and have had some success with. These include individual and partner coaching where we as a team provide our expertise on meaningful partnerships, capacity building, um, data visualization, and it's really tailored to the person that is on the other end. And so we work together to customize these designed programs or consultations that you'll hear about in a little bit. The other service that we've already started providing and is just getting off the ground, I encourage you all to go to pennreach.org to see it in action and to potentially create a profile, is our Connect networking platform. So this is our version of, I guess, online dating, but online partnerships. Similarly, you set up a profile, you answer questions about yourself, you are then in the database and externally facing profile of people on the Connect platform on our reachpenn.com or org. I always forget. Maybe Andrew will put it in the chat website. And you could find people that might have similar interests. There's a search platform to the left that you can see in a small picture on the screen where you can filter by community or academic or base or interest area. And this is open to trainees.
I think Sarah's having some issues. I'll continue with the Connect networking platform. So again, I'll just encourage you all to go to reachpenn.com. You can create a profile. You can find folks with similar interests, both on the community and academic side, and help build connections through that way. And then there's a Learn Resource Library, which we're currently building out. This is a library of tools, resources, videos, articles, things related to community engaged research, some of the health topics. We'd like to invite you all to share your resources, your publications, your articles, things that you think would be useful for the Learn Resource Library, and we will be sure to add them as well. Sarah, do you want me to continue or do you want to
Yeah,
pick up?
I can try. If I get kicked off one more time, I'll let you take it from here. I
Okay.
don't know. I'm having these problems. Okay. So next slide, Andrew. So those are our main programs and services. As we've said, we've started implementation, and something we're excited about is developing customized programs to meet the needs of different, community and academic stakeholders. And so I'm going to give you a few examples of those. Next slide, please. Here are just some broad examples about what we've been able to do. And this is the success and from the Community Scholars Program and along the continuum to reach. So the first is what we're really, really excited about. But a lot of our Community Scholars alumni or people we've worked with have been able to grow their pilot studies or some of their original ideas that they pitched at the symposium into larger grants. We have organizations such as Lutheran Settlement House, Nature PHL, Young Chances, Achievability, and the list can go on, where they've been able to obtain those sources of funding on their own, and in cases in continued partner academic partnerships. So additional benefit to the community organizations that we're working with, you saw previously in some of the outputs from our evaluation, was that community partners do feel more prepared to enter this research partnership, and not just prepared in the sense where they have skills, but as we've learned, they have more trust in the research process, which is critically important. One of the quotes is listed here from one of our scholars, that they give you the tools, the knowledge, and the language. So when you start talking to an academic partner, you say to yourself, oh, I know what that is. And oh, I've done that before. And you feel prepared. So this is something common that we've heard. We've also been able to work with people across the university in their own grant proposals. So with our commitment to equity, we've partnered with, as an example, the part of a NIH-funded Amethyst Hub at Penn to support the NIH in their improved centers of excellence in the implementation science core. So, and we've partnered with Policy Lab. We're currently working on an initiative as well as external to Penn, such as the City of Philadelphia in their community expansion grant capacity building. So from building capacity among community organizations to working with academics to help forge partnerships, strengthen grant proposals, and then helping, staff, partners, faculty, and trainees build partnerships. We think we have a little bit for everyone, but all with the ultimate goal of increasing equity, and in doing so by forging long-term sustainable community academic partnerships. So next slide, please, Andrew. I'll conclude with a question for you all to think about, and for us to continue our conversation through some Q&A. But in addition to being a capacity builder and a connector and a collaborator that we've talked about, what else? When you think of creating and sustaining community academic partnership, what resources at Penn come to mind? And we'll put the question on the poll everywhere. Can we see Reach, Bridging the Gaps, the Netter Center? Things are still coming in. But one point is that we have existing programs, existing faculty that carry this breadth of expertise and resources, and then we also have gaps, and we've heard about these gaps, and we've been very intentional to understand some of the needs so that we can address this in our programming. And we're really excited to engage in a conversation with you all to see how we can work together. Next slide, Andrew. So a few things that you could do to get involved right away is sign up for our mailing list, where you can stay up to date with opportunities and ways to engage. And to sign up, you can just click a button on reachpenn.com. Thank you. We'd love for you, as you mentioned before, to create your own partner profile so that you can utilize the Connect Collaborator networking platform. And of course, we'd love to hear from you in some of your individualized needs, and we're open to a consultation to see how we can support your goals, and you can make those consultation requests directly online. So thank you so much. And yeah, we'd love to open it up to any discussion and Q&A.
So no questions, no thoughts from anybody?